So here's a question that Stuart's going to take us through, but I'll read it in case you're driving or doing something. It's a 35-year-old woman who's brought in to the emergency department after a suspected suicide attempt. She is jaundiced and has dry mucous membranes. She was found next to a suicide note dated 3 days ago. Okay. Her vital signs, she's got a heart rate of 105, a blood pressure 105 on 72, respiratory rate 24, temperature is 36.1. She is unable to follow commands and is markedly disoriented. Her labs show that her bilirubin is high, her ALK phos is high, her AST is in the 7,000s, her creatinine is also elevated, and her INR is 6.9, also elevated. Her initial EKG is unremarkable, and the question is, which of the following is the most appropriate definitive therapy for this patient? And the first one you have is activated charcoal, B is hemodialysis, C is liver transplant, and D is N-acetylcysteine. Which of those do you think is the definitive treatment for this unfortunate patient? Let's have Stuart take us through how he thinks about these questions.
So this is a Tox question, and that's really important because Tox questions can be really hard when you don't know that. But here they have the suicide attempt and the suicide note right in the question. They also tell you that it's been 3 days, so that's really important. And then when you see that she's really, really sick, she's tachypnic and she's disoriented, together with these very abnormal liver tests, you can pretty much be assured that it's going to be an acetaminophen question. And so that's what we're dealing with here. And when you're dealing with a very late acetaminophen toxicity, where the patient already has severe end organ damage, here also the kidney is affected as well. All of these other therapies, the charcoal to prevent the absorption of acetaminophen in the first place, it's too late for that. The NAC is great, the N-acetylcysteine, and she's going to get that. It doesn't matter how long it's been. If it's from acetaminophen overdose, they're going to get that. But clearly, again, that's to prevent liver damage. Here, the damage is already done. And so that's not going to do it. With respect to hemodialysis, that's a really good foil here because she is in renal failure. But again, it's not the primary or the sort of definitive therapy, which is what they're looking for here in the question. And that's, of course, what she has is liver failure that needs a transplant. That's what she needs. And so that's that.